Good evening. My name is Joe Lee, and while we wait for Jeff Oxendine to come online, I apologize, for the technical difficulties, but we'll go ahead and start the presentation. Jana, can you go into the slide mode, please? The presentation mode. Thank you so much. So today, this is a webinar that will be specifically talking about exploring careers in primary care. Jana, if you can go to the next slide, please. Jana, can you hear me?
Yes.
Could you go to slide number 2, please?
2. Sorry about that. Hold on.
We're going to back up a little bit. We'll go to slide number 2.
Okay.
Thank you so much. And I am just turning on my webcam. Just to provide an overview of today's agenda, we will provide an overview of Primary Care Corps, which is an organization that was started by a workforce coalition called the East Bay Health Workforce Partnership. Today, we will have speakers, myself, Joe Lee, and we have Aline. Am I pronouncing your name correctly, Aline?
Yes. Aline Beach.
Aline Beach, thank you. She is the lead workforce planning consultant for Kaiser Permanente, and myself, I'm the workforce development strategist for a nonprofit organization called Alameda Health Consortium and the Community Health Center Network. And Jeff Oxendine is the one who is really coordinating all of this, the Primary Care Corps. He is the co-director of the California Future Health Workforce Commission, as well, and he is also at the UC Berkeley School of Public Health. So after we explore some careers in primary care, we'll move into a Q&A session that'll be moderated by Jeff Oxendine, and we'll have closing. Jana, if we can move to the next slide, please, that'd be really great. And before we begin, we would like to thank our supporters. And our supporters are Kaiser Permanente, the School of Public Health at UC Berkeley, Alameda Health Consortium and Community Health Center Network, my HCN, or my Health Career Navigator, and the Public Health Institute. Jan, can we move on to the next slide? Janet, can you hear me?
Yes. Do you want, is this the slide you want, or do you want the next slide?
Can you move to the next slide, please?
Okay. All right. Joe, do you see the new slide?
If you could go to slide number 3, please, that'd be really great.
Okay. So I think there's like a delay in the showing.
It looks like so. It looks like it. No worries. So I will continue talking. So for folks who are unfamiliar with Primary Care Corps, we really encourage everyone to join this organization. You can access this through our website, the East Bay Health Workforce Partnership website. It's also, the link is ebhwp.org. So,
next slide.
Yes, please. That'll be really helpful. I don't see the transitioning happening on my end, but that's okay. So I'm going to have Jeff Oxendine, when he comes on board, to talk about the slides that he has prepared. But just in a nutshell, I just want to provide some information to everyone on this call in terms of, who constitutes the primary care and prevention workforce. And those are primarily clinicians in primary care offices and clinics. And the primary care and prevention workforce also constitutes staff of community-based organizations that provide preventive services. And Janet, just to let you know, I'm on slide number 6. I'm not sure if that's responding on my end. And the primary care team really is comprised of multiple professions, such as registered nurses, physicians, physician assistants, advanced practice registered nurses, pharmacists, health coaches, clinical social workers, and so much more. And this is the direction that healthcare is certainly moving towards in terms of having a interprofessional primary care team to really focus on improving the health of our populations, improving the individual experience of care for our patients, and also reducing per capita costs. And I would also like to mention that who constitutes the community-based prevention workforce. We have a lot of different agencies and key players, such as public health professionals. We have community health workers and promotoras, and staff of other public agencies, such as EMS and housing and social services, as well as community-based organizations and churches and food banks and support groups that really constitute a community-based prevention workforce. So I'm going to actually move forward and just talk a little bit about my role in the Community Health Center Network. And Janet, I just want to check in with you really quickly. Are these slides moving on your end, or is there a delay in the system?
Yes, right now I'm on who constitutes the community-based prevention workforce.
Okay, great. If you can go to slide number 16, please, that would be really great.
Okay.
Thank you. So as I mentioned earlier, I'm the workforce development strategist, and I serve as a healthcare consultant for federally qualified health centers in the East Bay. And I have worked in this field for over 7 years in the federally qualified health center landscape. And I'm incredibly passionate about building tomorrow's workforce to advance health equity and social justice, especially for underserved communities. I also serve as a public health advocate, a workshop facilitator, and advisor for several healthcare coalitions. And for those of you who are curious, I received my bachelor's degree from Cal or UC Berkeley, and I'm currently enrolled in the Master of Science in Healthcare Administration and Interprofessional Leadership program at UCSF. So today, Jeff Oxendine has graciously invited me and Aline to share, what it is that we do, and to talk about the primary care workforce field. And we'll go in the order of providing a general overview of positions in primary care, an overview of the primary care landscape, and also just general requirements or considerations when thinking about pursuing a career in primary care. So I'm going to actually ask Janet, if you can switch over to the slides I sent you through the Google slides. Could you switch over to that, please?
Yes.
So I want to just note that I provide consulting for federally qualified health centers, and we we have 8 federally qualified health centers in the East Bay area, and they are, if you go to that second slide, please, of that PowerPoint that you're on, Janet. Thank you very much. Can you go to that second slide? Thank you. So the organizations that we serve, these are nonprofit community health centers in the East Bay. They include Asian Health Services, Access Community Health, La Clinica, Lifelong Medical Care, Native American Health Center, Tiburcio Vasquez Health Center, Tri-City Health Center, and West Oakland Health Council. Jana, I see the mouse moving. Are you able to click on the second slide?
Yes, this is the second slide.
Okay. I'm probably experiencing a delay on my end. And all of our federally qualified health centers, we provide primary care services, mental health services, as well as intensive case management. And we address the social determinants of health. Social determinants such as housing and education, and access to jobs and green spaces. These are everyday social determinants that impact a person's health and well-being. So to provide a general overview of positions in primary care at community health centers, such as Asian Health Services and lifelong medical care, there are positions that are, the positions that you may typically hear of in a primary care setting, such as physicians and physician assistants and nurse practitioners. And we also have, as part of the primary care team, clinical support positions such as medical assistants, case managers, care coordinators, and patient navigators. Also, within that primary care setting, we have opportunities for research, and we employ research. And of course, to support the wonderful primary care providers and all the primary care clinical staff, we have healthcare administration professions such as those in the communications department or development, finance, IT. These are all essential in the primary care setting. So let me just check in terms of the overview of the primary care landscape, we have a lot of job opportunities that are open for high school grads, those with a bachelor's degree and those with a master's degree. And these degrees can be health-related. They don't always necessarily have to be health-related. And I would just like to point out some examples for those. Say, for example, if you have a bachelor's degree, you are certainly qualified for positions, clinical support positions, such as case managers, care coordinators, and patient navigators. I'll give you an example of what a case manager does in a primary care setting. They deliver and document face-to-face care coordination services with our primary care and behavioral health providers, and also help with connecting our patients to resources such as housing, affordable transportation, access to food to receive more nutritious meals. I would also like to highlight an additional position that folks with bachelor's degrees are eligible for, and there are care coordinators. These are care coordinators who are members of an integrated system of a care team where they support our primary care providers, and they're mainly responsible for care coordination duties that are including but not limited to counseling of individuals, facilitating educational / process groups, talking circles, cultural counseling groups and activities. And we also have other clinical support positions such as medical assistants who are such a vital workforce in primary care, supporting our primary care providers and ensuring that we are delivering high quality care for our patients. They typically are responsible for documentation for our patient record, or our patients' health records, and also rooming patients and providing a preventative such as immunizations, vaccinations, and things like that. And and for our community health centers, our medical assistants don't necessarily have to be certified. I get that question a lot. Do they have to be certified medical assistants? Not necessarily. We hire uncertified medical assistants as well. And last but not least, going off of my notes here. So general requirements and considerations when thinking about pursuing a career in primary care. And for our community health centers, we certainly value folks who are passionate about health equity and who are mission driven, and folks who really want to make a difference. There are a lot of health disparities that we see in underserved communities across just within the Bay Area, for instance, in Alameda, Contra Costa, Solano, and San Francisco counties. And we are looking for individuals who have lived experiences, particular lived experiences that may allow them to be more culturally sensitive and culturally competent in their way of delivering care Additionally, we are also looking for individuals, health professionals, who can practice cultural humility. We're looking for those who are lifelong learners, those who are able to deliver care, not just in a very competent and sensitive way, but having that willingness to learn, having that ability to have that critical self-reflection, and also to not be afraid to ask questions like, hey, I don't know about this aspect of your culture, and can you please tell me more. This really is important, especially when we have service providers and patients. When they're working together, we really emphasize this respectful partnership to take place, and this is incredibly important. An additional skill that may be required for a lot of positions that I'm seeing is a skill, what is called motivational interviewing, or MI. So motivational interviewing is a type of counseling skill where you're able to have change talk, a comfortable change talk with our patients or clients, and helping them achieve a healthier lifestyle. And many times, we're so used to living in a world or being in a healthcare setting where we receive direct advice from a service provider, a primary care provider, or a health educator, and that doesn't always necessarily work out. How can we tap into the main motivations of the individual that we're helping out? If we are demanding them to eat a healthier diet to help manage their chronic disease, such as diabetes, we have to figure out what are the main barriers that the patients might be experiencing in their everyday lives. Do they have access to a kitchen? Are they able to afford fresh food? Is there an availability of grocery stores in their immediate neighborhood? So looking at social determinants of health and motivational interviewing is such an essential skill that can really help bring that out, that kind of information out. So I would just like to just end with sharing my personal experience in pursuing a career in health. Obviously, I am not a primary care provider or a physician. I get to work with a lot of physicians. I accidentally fell into the world of community health centers. At Cal, I studied public health, and after graduating, I just really wanted to seek job opportunities that were meaningful, where I felt like I could make a difference, and where I could just learn more about myself. And I used to work in do environmental justice work and do some community organizing, and I worked for the city of Berkeley at one point. And through networking and one door led to another, I worked for one of our FQHCs, or one of our federally qualified health centers, lifelong medical care, and just absolutely fell in love with their mission and their core values, and I felt like I did a lot of meaningful work there. I was actually a program manager for an AmeriCorps program, and I'm a proud dad of 85 AmeriCorps alumni, all who are pursuing just incredible careers and pursuing their higher education aspirations in medicine and social work and nursing and so forth. And this is where I found my calling and my passion for workforce development, workforce and leadership development. And today, at the Community Health Center Network, I have the absolute pleasure of being able to solve for critical issues as a consultant across our different federally qualified health centers. Issues like retention and recruitment of primary care providers. How do we boost provider wellness? How do we strengthen internship programs and volunteer opportunities for students and connect them to meaningful opportunities? So that's just a slight overview, a small overview of the work that I do. Now I'm going to stop right there. I believe I've covered all the talking points that I wanted to cover, or that I need to cover. And I understand we'll have time for Q&A at the end. I'm going to now shift over to Aline Beach. So Janet, if you can go back to the original slide,
Yes.
The PowerPoint slide,
Yeah.
that would be really great. Okay. And go to, you can get out of my my slides there. Go to the other slide, and go to the slide number 14, I believe. That's where Aline Beach's biography is listed. So while we wait for that to happen, thank you. So, Aline, you're on. It's your turn. Yes.
So
Jeff,
just to let you know, this is Jeff Oxendine. We finally fixed the technical difficulties. Apologies for that. But we are going to go to Aline, but I just want to let you know that we are going to have time for questions at the end. And so if you have questions, type them into the chat box that you have, and that way, and you can do that as you're going along. If Joe mentioned something that you're really interested in, go ahead and type in the questions now, and that way when we come to the end of after Aline, I'll make a few comments, and then we'll have time for questions. So please type them in along the way, and take it over, Aline.
Okay, so I'm Eileen Beach, and I work for Kaiser Permanente as a workforce consultant. I've worked here for almost 11 years, and our job is to look to the future and figure out the kinds of needs that we have. And if you wanted to try to pass me the ball, I could show you a slide, but maybe the best thing to do is just to talk from the slide. I just have one, and I'm going to talk about changes in ambulatory care. So I see 4 big changes in ambulatory care, and please understand that Kaiser Permanente is an integrated health system. So we really are focused on health as opposed to sickness. And by integrated, that means that we provide insurance, and we also provide care in the hospital, care in the home, care in the ambulatory setting. So we're in a very good spot to think about how we best care for our patients. And more, we have patients and services in the ambulatory setting, and just very, very sick people in the hospital. So that's just the overall change. And as a result of that, there's some particular changes. The first that we're seeing is the role of the nurse. And basically what we're trying to do is get all the nurses to work at their highest possible scope. So a nurse practitioner is in some cases actually getting a panel of patients to work with, and not just assisting the physician. The RN is much more of a care coordinator, making sure that services are connected from the hospital to the ambulatory to the home. We have nurses that are doing research, looking at best practices and how to improve training and other sorts of practices in the hospital so that the care improves and the population of cares improve. And you see LVNs and MAs much more in the direct care role. So in an ambulatory setting, the nurse is very much set up traditionally to be an assistant to the physician. And because access is such an important issue and making sure everybody gets the appropriate skills, we are looking at the workforce to utilize the skills of all the nurses at the highest level that they can practice at, so that we can expand our services. And what we found in many cases is most patients really need the teaching and education of an LVN or an MA maybe, and regular monitoring, that those kinds of things are really important. And then the RN can look at the whole panel, and the nurse practitioners and the physicians and the other people on the team can work with the sickest patients. The second big trend, and this is something that Joe mentioned, is the use of the interdisciplinary team. There is a whole range of people that are available to provide services, but the big role now is to try to figure out who's the right professional person to deal with the patient and their particular problems? Is it the social worker? Is it an RN? Is it a physician? Is it a pharmacist? And then also to integrate their services with each other so that, again, their expertise is highlighted. The third big trend that I want to mention is the acuity of the patients that we see. The ambulatory healthcare patient there's a huge range from people that are basically well and are there just for the purposes of checking up or getting a vaccine or doing regular tests just to maintain their health and to make sure that everything's going well, to people who are actually getting surgery. So we have a lot of people and a lot of ambulatory surgical units. Again, this is a huge effort to keep people out of the hospital where you really do get sick. That's a big shift in the ambulatory care. So there's a huge variety of kinds of services. And I think that's an appeal for the ambulatory setting because you have such a variety of patients. And like all in healthcare, our populations are aging. And so that means that there's more and more specific care that has to be provided to the senior aspect of the population. The fourth big trend is virtual care. Many people, particularly millennials, but across the board, we're finding if they could find a way to not have to travel into the medical building, they would like it. So I think the number is something like 52,000 televisits that we had last year at Kaiser Permanente. People who are selecting the option of with the physician either on the phone or the nurse practitioner either on the phone or through Skype or some other video practice. It's also a great way to check in on folks. So they may have an in-person appointment, but the follow-ups are also virtual. And it just saves and so much more convenient for everybody. And when you're sick, you don't really want to travel. So that's a great capability. It speeds up care. And the other, we're seeing it, this is really home care, but we're even in some parts of Kaiser Permanente, we're trying to do hospital in a home. And lots of virtual care and telemedicine is involved in that process. So those are the four big trends that I see looking out into the future.
And Eileen, this is Jeff. Can you just talk? Those are big trends. Can you talk therefore about the type of careers and that you see emerging that people that are at the beginning of their careers may want to consider, given those trends, and some of the ones that Kaiser is planning for in the future to be really, high growth?
Yeah, that's an interesting question, because we are starting not to think about things from the standpoint of a career in the sense of, an RN, an LVN, but of various technical skills combined in different positions. For example, a lot of times people talked about having an MA or an LVN, and what we're finding in the future is that we might have somebody with the skills of an LVN who also has some skills as a phlebotomist or a radiologist. So mixing up the skills to help with the care and expanding the sites and the kind of care people can get in individual sites. The other thing, of course, is the role of technology, and so informatics and any kind of data management. We were seeing that a lot in nursing, so that particular skill is really important. And as Joe mentioned, the idea of continuous learning is critical, because information and science changes so rapidly now. The figure I've seen is every 18 months. You have to be a continuous learner in order to keep up with the science and to give the best care to the patient.
Okay, thank you. So Eileen, thank you so much for telling us about the trends, and your job as people that are looking at your future careers in primary care or in other health professions it's really important to be aware of what the what the trends are in the way that health is going to be promoted and delivered, and then to, as was just said, to understand what kind of skills are going to be needed to be successful in those settings, and also then what kind of particular paths that you might pursue going forward. And I think what you've heard from our two presenters is that primary care and health delivery overall are going to be changing pretty dramatically over the next few years, driven by advances in different delivery models and focuses on things like the social determinants of health and the use of technology and all of those things, which make it a great time for people from your backgrounds to be coming into the field, because you have a lot of those different kinds of, by nature, some of those skills, and that you will be able to develop them going forward. I think it's the best time that I can think of in my 30 plus years of being in the health field to pursue careers, and particularly in primary care. As Joe said earlier, primary care is in high demand, both because of the shortage of workers in some of the key professions like physicians and physician assistants and nurse practitioners, but also because of its importance in terms of improving the health of individuals and the population, and in terms of the focus on team-based care and how team-based care is going to be integrated both for the whole person, including their physical and behavioral and overall health needs. And so, as you heard from our two presenters, there's a wide range of different roles that are going to be needed. And I think that's a key takeaway from today, is that there are many opportunities going forward all throughout California and all throughout the country, particularly those of you who are from the East Bay. We have a definite acute need for more primary care professionals in the East Bay. B, that it's going to be in an exciting new environment, and C, that there's a lot of different ways. So you can impact and be part of the primary care team, whether you are a physician, a nurse practitioner, a physician assistant, a registered nurse, an LVN, or whether you're another member of the team, a social worker, a nutritionist, a pharmacist, or really emerging career opportunities in as community health workers, as health navigators, as health coaches, as MAs and panel managers and care coordinators. So those are all things that you should learn about to find out what are the options. And we'll be having more sessions on through the primary care core, which is really designed, and this is just the first step, designed to provide you with more exposure to what the opportunities are, better information about how to pursue them, better opportunities like internships and connections to jobs and shadowing, and also better advising to go forward. So you'll be hearing more from us going forward. So I think with that, and I also should just say that you can provide primary care in a range of different settings. It can be in a large health system like Kaiser Permanente. It can also be or within a Sutter Health or a Stanford Healthcare that is now practicing here in the East Bay. You can provide it in a more of a outpatient community health center setting, like the federally qualified health centers that Joe works with through his network, the Community Health Center Network. And then you can provide it through private physician offices. Many physician offices physician offices deliver primary care, and they're increasingly using primary care teams. There are public hospitals like Alameda Medical Center here, or San Francisco General over in in San Francisco. And as Aline mentioned, there'd be more focused on even helping provide more services to people in their home and through telehealth and those kinds of things. So the settings are changing in addition to the roles, and so hopefully this session today helps you get some better knowledge about what the opportunities might be and how you can begin to pursue them. So unfortunately, I guess we were not able to have Amy Garland join us today. She is from the Joint Medical Program at UC Berkeley and UCSF as a primary care physician. Hopefully we'll get her to be able to participate on a future webinar. It looks like she may have just popped on. Amy, are you available? Well, while we're waiting for Amy, why don't we see if there are questions that any of you have? Janet, do you see any questions in the chat box?
Hello.
Hi, Amy. Hi.
Hello,
Hi,
Amy. So, Amy, my sense is given the time here, we have about, why don't you give just a little bit, maybe about 5 minutes about your background and role and any perspective you have in addition to what you've heard, and then we'll have a few minutes for questions. So go ahead, Amy.
Sure. Can you hear me?
Everybody
okay?
can hear you. Yes.
Okay, you're a little bit garbled, but let me know if you can hear me well enough. So I am a primary care provider here at Altabate Summit. I take care of people with HIV, but I do full service primary care for those patients. And I started my medical career at UCSF. I was pretty sure after my clinical rotations that I wanted to be a primary care provider, so I matched in a primary care residency at Penn. I ended up changing programs because my partner moved to a different part of the country, and to make a long story short, finished up doing specialty training in infectious disease, but still feeling drawn to be a primary care provider and to work with people in the way that only primary care providers do. And so I found a niche to do primary care within my specialty, which is HIV primary care. And for me, you know, the things that are most rewarding and meaningful to me about my work as a doctor are things that are really enriched in a primary care setting. And for me, that's the relationships I have with my patients over time, the ability I have to really get to know people, and the full context, all the context of their health issues, and to come to know them as people. And you know, some of the challenges in primary care, people complain about not having enough time to do get better in the context of longitudinal relationships with patients. And I've really stuck with primary care over time.
Hi, I believe we were having just a brief connection issue. Oh, yeah. Amy, you're on.
Okay. Maybe I'll stop there and see what questions people have and what people are most interested in hearing more about.
Okay. Let's see here. Okay. So I think one of the questions I have here is, how do you see the new healthcare law and just the ongoing debate in Congress about just how we're going to change healthcare insurance so that it's more that increases health access? How do you feel? People in the primary care field? How would that affect just in terms of employment growth moving forward?
okay, I didn't hear all that question, but I think it's how some of the changes in insurance coverage might affect primary care providers or people in working primary care settings.
Yes.
I think now that this is
Sorry,
Jeff,
I'm losing you again there, I think.
Can you hear me now?
Yeah, I can hear you.
Okay, so this is Jeff Oxendine. I think that right now the changes, if you're talking about changes at the federal level, there are still no changes to the way that the direction that things have been going, and most of the things that are currently in place are all leaning much more towards a growth in primary care and a growth in primary care and what's called value-based care, and which is a real focus on helping people get not only access to care, but then get health outcomes and better patient experiences. There's something called the triple aim, which is trying to improve population health outcomes, trying to improve the care experience that the patients have, and trying to reduce the cost per capita. And that is something that the federal policies and payment are incenting that, as well as commercial policies and payment. And then in all cases, there is more of a, from all different, both at the federal and state and commercial level, there is a focus on having people receive treatment in primary care and as Eileen mentioned, ambulatory settings, so that it's more cost effective and that there's more prevention and that care is provided at the right time and that early on, and so that people are getting quality. There's a lot of evidence that shows that people get good primary care, have better health outcomes and lower cost and those kinds of things. So I think right now everything is going in the direction of more incentive for primary care and more integration of primary care with population health and improving population health, and with more integrated with behavioral health. And so I think that's why there's a huge emphasis at the state and federal level of having more primary care providers and other members of the primary care team. And I think you'll just continue to see more of that.
Beth, this is Jolie. I would like to make a quick comment about the healthcare law. The Affordable Care Act, which was passed in 2010, that has, and especially when we had Medicaid expansion or Medi-Cal expansion here in California, I believe starting 2014, that has provided insurance coverage for tens of thousands of Californians just statewide, and that has also led to an increase of access points of community health centers statewide. So the Affordable Care Act has been such an integral piece of legislation that has increased access to care and really increased the primary care workforce, and increasing the number of clinics and health centers. Given the current political climate, I'm going to throw my advocacy hat here with to represent our sister organization, the Alameda Health Consortium, where we engage with legislatures about health policy and to advocate continued coverage, especially for the most vulnerable populations in our community, low-income individuals and families. And this is a tough fight that we're having this year. And I would like to also mention that the CHIME Act, the Community Health Investment Modernization and Excellence Act of 2017, that's our most urgent priority currently, to ensure that we continue receiving federal funding between now and through the next 5 years for community health centers. Nationally, we serve over 27 million patients coast to coast in both urban and rural settings. And if Congress does not move forward with the 330 federal funding for health centers, this could lead to health center closures and lost jobs, decreased access to primary care. So for those on the call who are interested in about health advocacy, which a lot of our health centers stand for or do or commit to, the CHIME Act is of critical importance today.
So, Janet, do we have a couple of questions from participants?
No, not yet. I hope you guys are definitely free to send a question. Oh.
I think that's fine. So
Okay.
what I was going to say, well, just since we've got a late start, we will, if our presenters can go a little bit longer, we'll go for a couple more minutes in terms of maybe answering some questions. And I have a question for Amy. Many students are trying to decide about whether they want to become a physician, or whether they are interested in becoming a provider, like a nurse practitioner or a physician assistant, or whether they might not be interested in clinical, they might not be as interested or suited for clinical work, and they might want to, as Joe mentioned earlier, participate more on the administrative or policy or population health side of things. What advice do you have for students who are trying to make those kind of decisions? What advice might you have? Amy, you're on mute.
Can you hear me now?
Yes.
It seems to be muting and unmuting. I don't know why it's doing that. Okay, I'm not muting myself. Okay, so being a clinician is a great career, and being a PA and an NP are also great ways to be a clinician. I work with interdisciplinary teams in every setting where I practice as a physician, and I work with PAs and NPs really closely, and I think those are great options for people who know they want to work with patients, maybe don't want to spend the time to go through medical training to become an MD. It's longer, and maybe have a sense, already know that they want to focus in a primary care setting, and aren't necessarily interested in exploring some of the other options that are available through an MD route. If that's you, then being an NP or a PA is a great way to get to a career in primary care provision. As far as who's a career in clinical medicine and in primary care in particular, I think these are really important questions for people to ask themselves before embarking on a very long educational pathway. And really the best way to get a sense of whether it's for you is to spend some time in a primary care setting. I think some of the opportunities that Joe outlined earlier in the call, working as a community health worker, certainly all of his former AmeriCorps volunteers, I know, got some great experience in primary care settings. Spending time in those settings, talking with people who are doing primary care and really learning what the life is like and what the job is like is a great way to get a sense of whether it's for you. I'll tell you that my observations and my own personal experience of some of the things that are necessary for primary care providers in particular, I think you have to have a pretty high tolerance for uncertainty, for persisting in conditions that are suboptimal and largely out of your control. And I think you have to be a person who really does derive a lot of fulfillment and satisfaction from making connections with people. Because it's those connections and relationships, for me personally, that really sustain me through some of the other difficulties in primary care. When you do have those strong relationships with patients who are struggling with social determinants of health that are out of your and their control, and who are struggling with health issues that you can't fix, you are vulnerable to suffering with them on some level. It can be sad. It can be very hard to go through with people what they have to go through. But again, if you're the kind of person who really thrives on connection and who has a real empathic drive and recognizes the benefit that you can bring to people who are struggling in circumstances beyond their control just by being with them and doing what you can as a health provider to make what you can better, then it's a great way to spend your life.
And Amy, do the the PAs and NPs, do they get to spend a little more time with patients than physicians might be able to, and focus more on the holistic view, or is that just well, how do you see that?
Well, I mean, time is the constraint that determines that for any provider, PA, NP, or MD. In my clinic, NPs, the NPs that I work alongside have exactly the same practice that I do as an MD. They might be less likely to get involved in administrative duties or in research or in other kinds of activities. But as far as the actual content of their interactions with patients, it's really exactly the same as for us. But I think it is true that they may have, in general, more of a focus on patient care and a dedication to patient care, as opposed to some of these other kinds of activities that MDs can get pulled into. But it's really a very comparable job in a primary care practice, being a primary care NP or being a primary care physician. It's really quite comparable.
Thank you. And Janet, I think, had a couple of questions we'll take a couple of questions that we had from the audience, and then we'll conclude.
Yes. So this is from Ivy Pham, and this is directed to Jolie. So the question is, what are some common complaints of primary care providers, and what strategies are used to address and improve PCP satisfaction?
Thank you. That's an excellent question, Ivy. We currently in in a lot of our community health centers in the community health setting, we experience a lot of burnout, amongst PCPs, and I think this has a lot to do with the complexity of the complex care that they're delivering for patients with multiple chronic conditions and behavioral health conditions and whatnot. And there's a systemic issue with the reimbursement system. And traditionally in healthcare, the U.S. healthcare system, we've been pretty much our doctors have been paid by fee for service, or FFS. And basically, our primary care providers, they have these productivity pressures where they have to see anywhere between 17 to 20 patients per day, and they're only able to see patients in 15-minute increments. And the good news is that this is changing, and that we are exploring alternative payment methodologies where we're not so much focused on volume-based care, and as Jeff mentioned earlier, we're shifting towards value-based care, or pay for performance, where we are paying our primary care providers based on improvements in health outcomes for our patients. And so this shift from volume to value-based care is incredibly important, and it is going to be a strong trend in many healthcare spaces. And we are actually testing this in the state of California with the California Primary Care Association and with some FQHCs, even in our own region, who are committing to this alternative payment methodology or conducting value-based care. And I believe this is one of many ways to address provider burnout and to increase provider satisfaction. And some of the short-term strategies include implementing wellness programs for providers in healthcare systems and healthcare settings, and ensuring that we are providing as many supportive services as possible for our PCPs, because of the great and work that they do that can sometimes be, in most cases, be extremely challenging. So I hope that answers your question, Ivy.
Great. Next question, this is directed towards Amy, and this is from Amanda Moe. Amy, what is the most challenging part of your work?
Yes, okay, I can hear you again now, I think.
Yes. Did you get my question?
Nope, missed your question.
Okay. I asked, this is a question directed to you, Amy, from Amanda Moe. What is the most challenging part of your work?
Yeah, I think there are many challenges, but the most general way to put it is that I feel a great deal of responsibility for things that I largely can't control. And that ranges from the length of my patient visits, the fact that some of them cannot afford housing in the Bay Area anymore, to the fact that some of them are not able to follow advice or engage in conversations with motivational interviewing, Joe, about making healthier choices for their lives. And there's just so much of that is out of my control, and yet I'm held responsible for by a variety of actors, including myself. And this is an ongoing challenge, but it's a constitutive challenge. This is part of what this job is. And I think understanding, having an accurate expectation that is part of the experience of being a primary care provider is important in primary prevention of burnout. I think that some people often get burned out when they are imagining that they're going to be able to do a job that is actually different from the job that they actually have. There's a sort of a mismatch between their wish for what they can accomplish in their job and in their role, and what the reality of the situation is. And the truth is that there is a lot of good that can be done, and there are a lot of important connections that can be made, and there is a lot of improvement in people's lives and in our healthcare system that can be made on a day-to-day basis and over the longer term. But it's going to be a really, really long time before most of the problems, most of the frustrations that we encounter are going to evaporate entirely. So I think anyone going into primary care, or really into medicine in our nation, needs to understand that developing ways to cope with and manage and live with those challenges and frustrations is part of what's necessary for the job.
Thank you, Amy.
Thank you, Amy. So I think with that, I want to first apologize for the technical difficulties that we had. And this is the first webinar we've done as the primary care core through East Bay Health Workforce Partnership. And we've learned from this, and we will work out the bugs for the future. We will be having some upcoming webinars that we will inform you of, that will continue to provide more good information about pursuing primary care and other health careers. We hope this was helpful today. I want to thank the panelists very much for comments and for participating, and thank you for participating as well, and to Janet for organizing it. So stay tuned for more webinars coming your way. And if we can edit this one with some of the technical difficulties, we will go ahead and post this on online so that you'll have this available. But thank you all very much.
Thank you, Jeff.
Thank you, Jeff. Everyone.
Thank you. Thank you, everyone. Have a good night.